welcome to Cares Everywhere, where compassion meets community. I'm your host, Anthony Brown, aka the Ghetto Practitioner. Man, I'm super excited. I met this young lady, and I interviewed her once. I just had to bring her on one more time, folks. Today's conversation is one that connects science, spirit, and service. We're talking addiction, redemption, and recovery with Dr. Nicole Labor, a physician who's helping the world see addiction not as a weakness, but as a disease that can be healed. Dr. Laver, welcome to Care is Everywhere.
Hi, Anthony. Thank you for having me back again.
Back again. Perfect. I'm super excited. Super excited. Let's start with your journey, Dr. Labor. We might as well just jump right on into this. What, Dr. Labor, what led you to dedicate your career to addiction medicine?
Well, there's probably a couple of different avenues that led to this, but ultimately I'm in recovery from addiction 20 years.
Okay.
And I was actually in medical school when I finally acknowledged there was a problem and decided to get help. And so when I went to rehab and got treatment and did all the things, I went back to medical school and finished. And then I had to choose a field to go into. And as it turned out, addiction medicine was very new. There was already addiction psychiatry, but there was not really a lot of addiction medicine. So it seemed like a really good fit, number one, for my personality, because I'm very straightforward and blunt, and that seems to work well with that population. And number two, obviously, the street cred that I get from being in recovery myself.
Okay, great. And was there a specific defining moment early in your work that other you being in recovery that shaped your passion for this field?
I would say, so there's a couple of like moments throughout my life that probably really pointed me in this direction, but I would say that the moment that when I was in treatment, I went to rehab in Pennsylvania. I was in a rehab facility that treated healthcare providers, and there was a physician there named Dr. Dave Withers, and he was in recovery, and he was starting an addiction medicine fellowship program. And just the way that he was able to marry the two, like the science, the biology of addiction, but also the history of treatment of addiction, and then his own personal story, just it felt really intuitively good. And so I was like, that's what I want. That's what I want to do. I want to be like that guy.
Okay, you want to be like that guy. And then somewhere in my readings about you, you described addiction medicine as a mission, not just a profession. Can you expand on that a little bit?
Well, I mean, they always say that if you love what you do, you never work a day in your life, right? So
Okay.
I think that, I've been given some gifts in life. And the gift of intellect, the gift of being able to understand complicated things and sort of break them down for people to understand, the gift of being able to develop good rapport with people that other people struggle with. So using those gifts, God-given gifts, to essentially do my job, makes it feel like, okay, there's a purpose in my life. And my purpose is to help as many people using my God-given gifts as I can.
Okay. So you're able to be more empathetic with a touch of science to be able to reach the alcoholic or the addict out there in the streets. Okay, great. I love that. And it's like, so how did your medical training prepare you for the emotional side of helping people?
Huh. It didn't.
Okay.
Terrible.
Alrighty then, moving right along. And it's fascinating because, I work nights in behavioral health, and I've seen firsthand how care becomes more than clinical. It's personal. When we're reaching out, and a lot of people in my profession, a lot of people where I work at don't know about my personal history, even though I wrote an autobiography about it. And so I know definitely the separation between empathy and science. One is concrete thinking, the other one is like, how do you feel about that individual that you're in front? And so, would you say that as you're doing your treatment and things like that, tell me a little bit about empathy as being part of your treatment planning?
Um, I would say that I I use an empathy as a gateway into my intuition. And I think that I use my intuition when I'm treating patients. And over time, that in and of itself has become a skill, like honing that, learning when to trust what's going on in my gut about somebody, learning to be able to take that and then use it in a positive way for them.
Mm-hmm.
Versus, just kind of thinking about how is this making me feel? Um, why am I feeling this way? What is going on with this person that I'm feeling this? And I think that I think that I feel like that's become such a skill over time that I don't even realize that I'm doing it until other people are with me. Like I have medical students and I have nurse practitioners and I have people that come rotate with me for their education. And a lot of times they say, like, how did you do that? Like that, how did you know that? Or how did, that was cool the way that you were able to present that to that patient or whatever. So yeah, I think I don't even know I'm doing it sometimes.
Oh, okay. All right, moving right along. Let's just jump into some of the brain and the behavior and the belief section. Um, let, the science for people listening who only hear the word addict. Can you explain what's really going on in their brain when somebody or someone develops addiction?
Sure. So there's something that I call, and again, like I'm going to be totally transparent, like statistics are annoying.
Okay.
But if we look at the statistics and we can kind of be a little bit flexible with the numbers, what happens with addiction is something that I call the Laver 80/20, where I say 80% of the population uses some sort of substance, recreationally, alcohol, marijuana, whatever. Just 80% of all people, and we're going to say the US for now, we won't go globally. Of that 80% that use some sort of substance, 20% develop a problem where they're starting to have consequences. They have some issues. They are maybe legal issues or medical issues or family issues or financial or whatever. But of that small subset, that 20%, only 20% of those actually develop true addiction. So the other 80% of that little subset are the people who use drugs and alcohol problematically. Usually they'll say, oh, I used cocaine for 20 years and I just decided enough was enough and I stopped, and that's what you need. You don't need treatment. You don't need meetings. You don't need groups. You just need to make the decision to stop. And they're the ones that everybody in society looks at and goes, see, they could do it. Why can't you do it?
Mm.
And they're the ones that little 20%, that tiny 20% left over, they look at themselves and go, well, they did it. Why can't I do it? And those are the ones that have true addiction. And true addiction is what I define as a hijacking of the midbrain. So downregulation of dopamine receptors in the reward center of the midbrain, and then alteration of the frontal cortex because of that hijacking of the dopamine. So it's kind of like a two-part process that happens, but once it happens in the brain, it makes it substantially more difficult for patients or people to stop using without help. Like willpower becomes insubstantial, and they can't just use this willpower to stop. They need something more.
Mm. Okay, okay, and that's fascinating. And so, do you think, in your opinion, trauma or mental health issues have a play into that whole process?
Oh yeah, of course. So trauma actually looks pretty
Mm.
close to the same as addiction. So when someone has trauma or adverse childhood events or any chronic and severe stress, our body creates a hormone called corticotropin releasing factor, or CRF, and it's floating around. And when it gets into the brain, it starts pulling away dopamine receptors, which is the same thing that happens in addiction. So if you have trauma, your brain is already primed for addiction. And
Okay.
so then when somebody uses a substance, on top of a trauma, they feel normal. They feel good. They're like, oh, wow, this is the solution. So they continue to use substances, which continues to exacerbate or make the problem worse.
Wow, fascinating, fascinating. And so, knowing that trauma can be part of this whole thing, why do you think it's so hard for the brain to unlearn addiction once that occurs?
I think that if people aren't working through that trauma, like if they're not doing the things, and again, are we talking about just a PTSD? Are we talking about a complex PTSD? Like, and what kind of treatment are they getting? But they do need to work through that trauma. If they don't, then they're just going to keep jumping back on that highway of using over and over every time something comes up that they can't handle. But the unlearning process is just about learning new coping skills, because the best coping skill they have is to use substances. It works great, it's amazing, but it also causes problems. So the frontal cortex needs to rewire to practice new skills. And that's how we rewire, is you practice repetition, right? Learn a new skill, journaling, meditating, praying, whatever it is that we're trying to teach somebody to do, they need to practice and repeat and repeat and repeat until they wire it through their cortex in the same way that using substances was wired through the cortex as a solution. But we're not going to be able to do that if we don't address the underlying trauma.
Fascinating. Okay, well, good. And because I know when I study mental health, I learned that behavior is a communication, and understanding that changed how I approach people. It built compassion within me. And how can education do the same for our communities? Um, what do you think it takes out there? Because you're out there in the community with people, you're teaching all over the place, podcasting, and just I admire the way you approach education. And so, in addition to what you're doing, or what have you discovered helps as far as educating the community to help build compassion for the addict?
Um, I think that uh, bringing all of the science and biology down to a level that everybody can understand is always very helpful, because it allows people to kind of grasp these complicated concepts in a way that makes sense for them and resonates for them. But I find that education, like it really does have an impact not only on individuals, but on communities. Because even working within, for example, the community in Worcester, Ohio, Wayne County. When I first started working there doing medication assisted treatment, there was a lot of resistance from the community. And by simply going out and giving talks about addiction as a disease and why we treat things the way we treat them at churches, at doctors' offices, at the hospital, at other treatment agencies, like all different places, the acceptance and the support of the community has dramatically shifted.
Mm.
And so I do see that education can make a difference, but it just seems like this bubble and now this bubble, and like everywhere, you have to go everywhere. The work's never done.
Okay, the work's done. And um, in all of this work that you've done, and I understand from my experience, a lot of times people live in silos. They believe what they want to believe, and just not not to say infiltrate the silo, but just to bring people out of the silo to work collectively, because it is a community thing, I believe. And so, one of the things, or what are some of the things that you discovered in your education that's the biggest misconception that people still have about the addict or the alcoholic?
Oh, that it's a choice.
Oh, that
that,
is.
that it's a choice. So where people really seem to struggle is the fact that using substances initially is a choice. You choose to do it. And what I am always advocating is that, yes, but for that percentage of the population, part of their brain changes as a result of that, and they can't choose to undo that. So that part of their brain that's now addicted it's broken. We can heal it, we can treat it, but you can't undo it. And it's almost similar to, and I hate to do this comparison because people get really upset about it, but it's similar to, I'm choosing to use eat certain types of foods or smoke cigarettes or whatever, and I develop a brain tumor. Well, the tumor is still a disease. Just because it developed as a result of my choices doesn't make it not a disease, you know? And so that's kind of one of the most frustrating misconceptions. It's like, and I'm not saying they didn't make the choice, but 80% of all people made the same choice. They just don't all develop the disease. And so I have spent a lot of time like sort of fighting that misconception.
Okay, and it is sometimes it seems like a battle or a struggle, but somehow we seem to get up every day, tie our shoestrings tight, and take that next indicated step of getting out there in the community. And so, being a healthcare professional and me is the same. What are some of the ways, or what can you enlighten, or what can you share with me on ways, or other healthcare professionals, because again, being on the front line, so to speak, can sometimes be taxing. Sometimes we just want to throw the towel in, just for the moment. But what can we, or what advice do you have for us healthcare professionals that we can do to help protect our mental health, our mental wellness while we're helping others?
Well, that's a great question. Um, so I was very fortunate to be going through recovery before I was in full-blown medical practice. And so for me, the recovery part took precedence over everything. And obviously, when you're in recovery and you're getting treatment and you're going to therapy and you're doing all the things, like you learn very early that self-care is paramount to everything else. Like if you are not taking care of yourself, you cannot take care of other people. And so, learning how to be self-aware enough to know when you're burning out, to recognize when you've entered into martyrdom,
Mm.
and to be able to be humble enough to say, this is too much for me. I need to step back and I need to rework a balance in my life. And I would say that in my career, because I finished my fellowship in 2011. So I've been practicing in the field since 2011. And I would say that there have been three times now, three different times where I have kind of really reevaluated my work and shifted things to benefit me, time-wise, financially, family, balance, in a selfish way, because I felt like I was not really being of great service to my patients anymore because I was getting stretched too thin.
Mm. Okay, so take care of yourself, most definitely. Like you say, have a balanced life. Don't channel all your energy towards your work because you'll get burned out. If you're burnt out, then how can you benefit other people?
Right. Like, how do you pour from an empty cup? Or, if you don't put your oxygen mask on first, you can't help the person next to you and so forth. I mean, they're cliches, but they're cliche for a reason.
Hmm. Always always tell people standard earthquake procedure, because I'm from California. In the event of an earthquake, what do? You get out and save yourself first. Then you can go back and save other people. And I think that's very, very valuable, considering the fact that we do um, help other people, and we do take on a lot of their pain and their frustrations. And, you know, it's really important not to own that. But then how do you not do that when in your heart you want to be there for other people? But, there was a saying in one of these anonymous programs, you can't transmit something you haven't got, and make sure your own house is in order, which is great. And I know sometimes I wrestle with it. Sometimes I give myself too much to work, and sometimes it's important that I recognize this, as you said, so you can step back and refill your cup so that you have something to give. I know one of the, and people laugh at me, but I'll take time out and I'll light a candle and I'll drink some tea and listen to some classical music and just go off in the zone just to treat myself so that I can get out there and treat others. And so I think that's important as well. Moving right along, I'm thinking about at one point in time, I think I read somewhere that you mentioned the opposite of addiction isn't sobriety, it's about connection. Okay, and that's a powerful statement. What does that mean to you in your practice?
It means that I have to spend a lot of time fighting people who want to be isolating all the time.
Okay.
Um, I think that one of the greatest skills that we can develop to fight the addiction, to fight the need to use substances to solve problems, is to develop connection and relationships with other people. Scientifically, we know the oxytocin, connection with people is powerful for giving us like joy and pleasure. And human interaction and connection is very valuable to our physical and mental health. We know that there's like tons of data supporting that. Um, and what we know is that people who have active addiction tend to be isolating. Even if they're physically with other people, they are emotionally isolating. They're
Good.
not developing close friendships with people. They're simply using with people. And so when they get into recovery, they have a lot of social anxiety and they have a lot of desire to like not be around people and okay, that's how I'm going to get clean. And so trying to really reinforce this idea that you need a tribe of people, you need a support group, because you need somebody to hold up the mirror to you when you start to slip back into old bad behaviors. Like that's a
Ouch.
big part. Yeah. Yeah, it's a huge part of recovery, right? Is because we will default to kind of behaviors that feel comfortable. And sometimes that's not the greatest plan and it can lead us into trouble. And so having people around you that recognize that pattern is very useful. And it's not always family. Like even though your family may be very supportive and maybe they don't use and they're, good people, if they were enough, you wouldn't have got addicted in the first place. So you need somebody outside your family, and it doesn't have to be like a huge ton of people, just a couple of really close friends that are in recovery that get it, that just understand why, when you're in a situation that seems counterintuitive to wanting to use, you see somebody overdose and it's like normal people are like, oh my God, that's terrible. And as the addict, you're like, oh, that's terrible. Let's save him. But secretly, like, well, where did he get that stuff? Or like,
Right.
how can I? And that weird stinking thinking, I guess they call it, right? They stinking thinking. That is very indicative of old behavior patterns and it will sneak back in. So having people around that recognize that and can go, oh yeah, I felt that too. Let's go get coffee. Let's go to a meeting. Let's go do something to get away from thinking about it all the time. I just think that that's very powerful.
Okay, thank you. And that's really fascinating. Sort of like having a accountability partner, And I love that you brought up that fact that have somebody put a mirror in front of you. Well, that can be painful sometimes, especially when you're in your head with this great idea that deep down inside it's gonna hurt, but hey, it might not hurt as much.
Right.
And to be around people to say, I recognize that in me. I've been down that road. Come on, let's go have a cup of coffee. Come on, let's talk about this. Let's walk away from this situation. It's really fascinating. Would you be able to share a small story or illustration that shows the power of connection in recovery?
Let's see. Um, well, I mean, I can't even think of my life out away from connection, like without connection. But I can say that so my first year of recovery, I was very much being compliant. The medical board was watching me. I was being compliant. I was abstinent and I was going to the meetings and the groups. Um, but I was still very much behaving like an addict. I was very much keeping my feelings to myself and I was still lying and manipulating and trying to create images for you to see that looked good so that I wouldn't get in trouble. And um, I was still engaging in behaviors that were shady and questionable, just not using. And I didn't feel good about myself, and I didn't feel good about what I was doing, but I didn't really know what to do to fix it until I was at a meeting. I was going to 12-step meetings for healthcare practitioners, and because it was required.
Mm.
And there was a nurse there who, she didn't have that much more time in sobriety than I did, maybe a year more. But she was sharing in a way at this meeting that was so vulnerable and transparent and authentic. And something about it struck me really hard, that it just seemed so freeing to not have to constantly be doing the mental gymnastics to create this image and illusion, and to be able to just kind of honestly talk about the things going on without worrying that it sounds good. And she was doing that, and it just felt so like I was very drawn to it. And so I asked her after the meeting, like, how do you do that? Because
Mm.
I want to do that. I want to be that. And, she just talked to me for a bit, and she wound up being my sponsor. And for the next few years, dragged me along to all the things and gave me all these little instructions that did exactly what I needed to get me out of my own head and stop me from using my skills, and instead forced me to practice the skills that she had. And I just think that connection with her and that ability to see things from a shifted or a pivoted perspective made all the difference in the world to me. I think that was the moment that I went from likely relapse to likely success in recovery.
Fascinating. I was thinking, as you were sharing, I was thinking of the statement, um, keeping it real so you can feel to heal.
Yeah.
That's really powerful. And so sharing all of that, um, and again, you touched on it. I just want to draw out a little bit, especially on your knowledge when it comes to the brain. And so, how would you summarize relationship, community, and grace that help the brain and spirit heal together?
I'm going to say that again. So there's a piece of the brain where bonding occurs, right? Where we release oxytocin, which also ties into some of the other neurotransmitters that give us pleasure. So you're certainly serotonin, dopamine. So there is a way for some. So when someone's in early recovery, when someone is first we took away the drugs and they're just kind of like in the first, obviously up to 2 years, but they're real early. Um, they feel depressed, they feel down, they feel alone, they feel bored, they feel lonely. Nothing is giving them joy because they really can't get any dopamine, which is usually our joy molecule, right?
Mhm.
Because they don't have enough receptors. So those receptors are coming back if they're being abstinent. So the question becomes, how can we bring at least some sense of joy to their life so that they start to feel normal and start to pursue things that used to be joyful for them, even if they're not now? And one of the best ways to do that is to connect them with people, because those connections will sort of dump some happy chemicals in the brain and allow a person to start to feel better, if not great, but better. And when we feel better, we seek out that same thing over and over, hence drugs.
Mm.
So if hanging out with people, if interacting with people gives us some sort of joy or pleasure, we continue to seek that feeling. So we continue to interact with people. And that's how building and becoming a part of a community, is super beneficial to people in addiction. Like, the sense of belonging is paramount to feeling the human experience. Like, we feel so good when we feel like we belong somewhere.
That's powerful. It's so true. And so, for someone listening right now who's ready to change but they're afraid to, what's your message to them?
Do it afraid.
Do it afraid?
Do it afraid. Whatever. Courage is not the absence of fear. Courage is movement in spite of it. So if you want something, you have to do it. And if you're waiting to not be scared, you're probably going to wait forever. So it's a matter of, have you had enough? Is enough enough? Are you ready to make the change? Because it's going to require moving through that fear, taking one step at a time and accomplishing little things until you've disciplined yourself to be doing the things you need to do, even when it doesn't feel right, even when it's scary.
Okay, okay. And it's interesting 'cause I've seen people come alive, once again, um, what they feel seen and loved, just like watching Grace in real time. And that's what care is everywhere means to me. It's fascinating, Dr. Labor. Thank you. I appreciate you coming back to the show, sharing your story, your science, and your heart. And you've shown us that addiction isn't a hopeless condition; it's a call for healing. Um, for everyone listening out there, remember you're not being held. The same brain that learned pain can learn peace, and the same God who made your mind can renew it. To learn more about Dr. Labor's work, where can people get a hold of you? How do we get to know or get more information about what you have to offer?
I have like a bajillion things. You can go to my website. It's www.theaddictsdoc.com. I'm also on social media. I'm on Facebook as The Addiction Assassin. I'm on Instagram as The Addicts Doc. I'm on TikTok as The Addicts Doc. Um, I wrote a book, The Addictaholic Deconstructed. It's on Amazon. Yes. So there's that. I wrote a workbook too. That's on Amazon too. It's called just the Addiction Workbook. But I'm pretty accessible. I find that if people reach out to me on social media or through my website, I do respond for the most part. So yeah, it's not hard to find me. But I do a lot of just like reels and snippets of bits and pieces of education to share out on social media.
Okay, thank you, thank you. And again, to learn more about Dr. Labor's work, look up her talks and her teachings online. They're filled with wisdom and hope. And her TikTok videos are you got to check it out. You got
Obnoxious.
you got to check it out. Talk about something that's going to make you feel good and educational. Dr. Labor, you're the person. So thank you again. I appreciate your time. Thank you, folks, for coming to be with us with Cares everywhere. As always, you can always find me um, at the Ghetto Practitioner. You can always find me at anthonyhowardbrown.com. I'm all over the place interviewing all kinds of people. Great guests to have on today. And again, it's me, Anthony, aka the Ghetto Practitioner. Remind you that no matter where you are, a hospital, halfway house, or just trying to hold together, care is everywhere. And so until the next time, we will see you and thank you again.
You're the best, Anthony. Thanks for having me.
Thank you.